Hundreds of state patients are being held in correctional centres instead of receiving treatment at psychiatric hospitals. This has raised serious concerns in recent days about their human rights, mental health care, as well as the broader implications for the justice system. Let's take this further with Dr. Dudu Shiba, the Director for Mental Health at the National Health Department. A very good evening to you, Doctor. Thank you so much for being on the SABC. So the team at Ground Up is reporting that hundreds of people are now stuck in this limbo where they've been declared unfit to stand trial, yet they're being held at a correctional facility instead of the appropriate treatment centres. Why is that?
No, thank you very much, and thank you for having me. Yes, we have got something like 362 currently of state patients that are in correctional facilities and correctional services facilities. And this is against the total of 3,675 state patients that we have in the country, and that the 362 makes something like less than 10% of the total of those that are there. And I must say that though we are having provinces where there is a problem of patients that stay longer, legally and procedurally, after a state patient has been declared as a state patient by a court of law, they don't move directly to the department or to the psychiatric hospital, but the administrative processes that needs to ensue for this person to be accepted, moved from the justice system and accepted to the health system. And those processes take something like 28 days to 30 days to happen.
Right.
And in terms of the Criminal Procedures Act, whilst that is happening, that a person is supposed to wait at correctional services. So this 362 is not simply just because it's all of them that we can't accept, but there are those few here and there who are awaiting the administrative process.
How many is a few? How many have been waiting longer than the prescribed period of a month for that process to unfold? I want to figure out the ratio of people who are within the stipulated time frame and those who've simply been waiting for longer than a month.
I don't have the exact figure now, but I can say that at an estimate, probably if I look at the figures, I would say maybe something like 80% to 90% are those that have been waiting for some time, and then there is something like 20% or more that are just waiting for an administrative process.
Right.
And I must say that this problem is not in all provinces. We have it mostly in the Eastern Cape, and we have it in Mpumalanga, and I can state the reasons as to why in those provinces.
Okay.
And we also have it not in all provinces, I'm trying to say that.
But what I'm hearing you say, Doctor, is that while there is a prescribed period, majority of these 362 patients are people who fall outside of that window. So there is a problem. Why?
Yes, there is a problem. That is why I'm saying that there is a problem, and I'm indicating that our biggest problem is in the Eastern Cape. Eastern Cape, these problems are alongside the crime statistics, the issues of crime. If you look at Eastern Cape, there is high crime rate, there's high murder rates, there is poverty. There's always a link between mental health and poverty. We have seen that, and we have put measures in place. But the problem that we are facing is that in as much as we are increasing, we put plans in place and we have increased numbers, and the numbers are showing that we have created it, we have done all that we can do in the present. But as we are admitting, the new ones are being declared. There is a high number of people that are being declared as state patients because of all the societal issues that we are seeing. If I can just indicate that from January up to April, we already admitted about 118 state patients, taking them in from correctional services. In the last financial year, we admitted 408 state patients. And this shows that we are admitting, not that we are not admitting, but there is a bigger problem that is out there of the influx of people who are being declared state patient. And currently we are doing a lot of infrastructure, human resource, and many other things. And what I want to state also is that discharging a state patient is the judging chambers who does it. So our teams will treat and will get to a point where they are comfortable that this person will be discharged. But then when they apply to the justice, to the judging chamber, there is that reluctance in terms of granting those approvals. And as a result, there is a problem with the throughput. The people that we have are staying there, even those that we are comfortable that they need to be discharged. We can't discharge them because we are waiting for that go ahead from the judging chambers. And these are already coming through. And there are a lot of other challenges that, in the interest of time, I can't maybe mention, but if I'm given time, I can also indicate some other challenges and some other interventions that we are putting in place.
I hear you on the challenges. I hear you on the challenges, Dr. Shiba. What I'm interested in now is when these challenges will be addressed and done away with so that we don't see this list grow further. Because you're saying, for example, from the beginning of this year, there's been an increase in the number, over 100 more of these state patients, right, who are now still in the care of prison authorities when they should be in psychiatric centers. When will these 362 people be put in under appropriate care out of the correctional services system?
As I'm indicating, this is not a static number, a pool of people that we are supposed to move. But this is a number that is fluctuating. And as I'm indicating that whilst we are moving these numbers in, but others are coming in. And I must say we have really increased because we have put in place infrastructure and we have put in place other resources. But however, because these people keep on coming in, we can't say on such and such a day we will have no state patient. And by the way, there will always be state patients in prison, but the numbers will have to not go to that level high. That is why we are working. One of the biggest challenges is in Mpumalanga, not with the psychiatric, but we are working towards building a psychiatric hospital in Mpumalanga. There are infrastructural projects that are on in Mzimkhulu. We have finalized one in Fort England. There is one on in Free State. And we are doing a lot of things to address this challenge because it is alongside the risk factors that are coming into play now, and we are responding as a department as much as we can. And I must say, at a certain stage, these numbers were ranging at 400 and all, but we are bringing them down. But unfortunately, as I'm indicating, we have got a problem of throughput, and we are working with that through intersectoral forums where we sit with the judges and all to engage so that we are able to get those that need to go out to be able to be accordingly.
I appreciate the fact that there are patients coming in, perhaps even daily. But my question to you, Doctor, was about the 362, the number that you gave to me. When are those people going to be settled in the appropriate care facilities? Let's deal with that separately because that's the number you confirmed right at the top of our conversation. Are they going to be placed in the next week, in the next month, in the next 6 months?
I can't say in the next week or in the next 6 months. That will be very reckless of me to say that. But as I'm indicating that from January up to April, we took in 118. So if I'm using that as a yardstick, in the next quarter, we would have taken also maybe probably 300 of those or more, depending on the challenges that are put in place. And we can't say any other thing over and above that, because remember, we are talking about state patients, and these patients have got a level of risk, and we can't just recklessly pull them in and put them in areas where there is no, because they need some form of security, they need some form of human rights environment and therapeutic environment and the necessary resources, which we are working very hard to put in place.
And I'm glad you mentioned human rights, because that's the concern, that ultimately you are at risk of violating, as a government, violating the rights of people who are, in some cases, possibly mentally ill by keeping them in an unsuitable environment. And it is precisely because of that urgency, that level of risk, that I'm going to ask you this question again. Are you saying tonight that the department does not have a clear timeline that it's working against in terms of targets for the placing of at least these initial 362 people, getting them out of correctional centres?
There are plans in place and there are targets in place. I don't have the figures in front of me here, but as I'm saying, we have reduced these numbers and we are continuing to reduce the numbers. And I'm saying, judging at the rate that we have been able to pull in others, we are looking at somewhere in behaving have brought in the majority of these, but I can say that by June we will not be having 400 people because I can't control the number of those that are coming in, and also I can't control the approvals that we will be getting from the judge in chambers to grant the discharges for those that need to go out, and I can't also guarantee the availability of families to accept their loved one back when we are discharging them or we are reclassifying them. A system that is not having a throughput, you can't guarantee that what you are going to do because you need to have others coming out and then so that you have space for others to coming in. But
I get that, ma'am. I appreciate that very much, ma'am.
We are engaging a lot
Dr. Shiba,
with our justice. We are engaging
I
a lot
understand
with all
the challenges of people coming in as you're going along, right? I'm saying to you, what we're trying to get clarity on is for those who are already known to be in the system. You say you do have targets. Why are you as the health department unable to share those targets? And what are the potential safety and human rights implications of this continued limbo for these people? How safe are they in correctional centres? How safe are other inmates in a situation where they are basically imprisoned? I don't know what the placement system looks like within correctional centres, but what is the situation in terms of them, their safety and the safety of other inmates at the prisons where they are being kept?
Definitely, that is what we are worried about. That is why we are ramping up all our efforts to do that, bring them in, because we are quite aware that they are patients, that they don't need to be in prison. They need to be in health facilities where they are cared for. And in the meantime, whilst they are waiting, we are doing all that we can. And we are also having programs whereby our teams go and visit them there, our psychiatrists visit them there so that when they come in, they would have initiated some treatments. So there's a lot that we are doing. And we don't say it is a safe place for them to be in prison because they need to be in facilities. That is why we have ramped up. And as I'm indicating, never before have we been able to admit such a number of people that we have been admitting since the last financial year up to now, because we have put measures in place and plans in place to increase the numbers, and we are still working towards increasing those numbers and engaging with all the stakeholders that we need to engage with to ensure that whatever targets that we have and plans that we have in place, including increasing beds, increasing infrastructure, increasing human resources, and engaging in terms of the sectors, that we are able to address the problem going forward.
Dr. Dudu Shiba, Director for Mental Health within the National Department of Health. Good to have your time, ma'am, this evening. Thank you very much for being on The Full View on SABC News. Don't go away.